all want to achieve natural looking results. And
Yeah.
I've seen many patients over the years who've come in with what I call chiclets.
Yeah, we see them too.
Their teeth do not look natural, and the question is, how do you differentiate your group in terms of your ability to achieve natural looking results?
Yeah, that's another great question. There's this reputation among lay people about cosmetic dentistry sometimes, about porcelain veneers in specific, where they call them chiclets or, big white bunny teeth. And it's interesting because there's actually a little bit of a split in the country where a lot of West Coast dentists, cosmetic dentists will, the patients will ask for these big, bright, unnatural smiles. Patients will say, I want my teeth as white as possible, as big as possible. On the East Coast, it tends to be that people want natural, beautiful, sort of youthful looking teeth.
More
Because most of
subtle.
our patients, subtle, exactly. Most of our patients are, doctors, lawyers, bankers, working folk. They're not in Hollywood. They're not, they want to look natural. And while we can do everything in our office, and we sometimes have patients that come in that say, I want them super white, and we'll do it for them. It's obviously up to them. Our general goal is to achieve natural looking smiles. We want somebody to go out into the world, as I'm sure you do with your patients, and we want someone to, one of their friends to see them for the first time since they had their teeth done and say, wow, you look amazing. What have you been doing? You look great. We don't want them to say, what did you do to your teeth? Or, wow, you got veneers. No, we want them to say, you look great. You look so young right now. You look awesome. We want that natural look. And in that natural look, we tend to make the teeth a natural color. We make them a natural length. We try to mimic what that person's teeth would have looked like 10, 15, 20, 30 years ago, but in a natural way that fits their face, fits their skin tone, fits their personality, their sex. All of these things are taken into account.
So there's a lot of very interesting analysis that goes into the way you approach the patient in terms of looking at their whole facial composite, so to speak.